Hi, my name is Peter Goadsby. I'm Professor of Neurology at King's College London. I'm pleased to present to you a series of videos that raise awareness around migraine. Migraine is a common neurologic disease worldwide that is highly disabling and impacts the quality of life for people with this condition and those around them. These videos are conversations between physicians and people with migraine, where we'll hear first-hand experiences of people living with this condition and gain insights into the debilitating nature of migraine. These videos will cover migraine throughout a woman's life, stigma and attitudes towards migraine, untreated or underdiagnosed and misdiagnosed patients, migraine in the workplace,
I'm honored to be here with you to discuss the topic of migraine in the workplace. I'm Olivia Degasse de Dhaem, an assistant professor of neurology at the University of Connecticut and the medical director of the Institute for Headache and Brain Health. And I'm so excited to be discussing this topic today with Deborah Sloan, who generously agreed to share her experience.
Hi there, I'm Deborah Sloan, and I've lived with migraine for most of my life, and I'm now 60.
Thank you. So we will talk briefly about the experience of migraine and then the personal and economic impact of migraine in the workplace, and then delve into what healthcare professionals can do to help. Sharing your experience with migraine. Where did your migraine attacks start? What do they look like, feel like, and have they changed over time?
Sure. So my migraine condition, I believe, started when I was around, I think it was around 5 or 6, because I can remember having what I now realise is the aura stage of the migraine. And at that age, I didn't have the pain, but I used to have what's known now as Alice in Wonderland syndrome, and that's where you feel as if parts of your body seem huge. And for me, I felt as if my tongue, my hands were very big, too big for my body. The other thing I used to have was a feeling of just not being quite in the world, a bit vague, not engaging with the world very much, tuning out. Then when I was, I experienced this for a lot of my life. Also things I realize now, like phantom smells, phantom tastes. And then when I was 17 was when I first got when I had my first migraine, full-blown migraine attack. And it was completely disabling and very frightening. My migraines gradually became worse in my 20s. I say they were episodic. So I would get perhaps 2 a month, tied into my menstrual cycle. Then in my 30s, it started becoming maybe 1 a week. Then in my 40s, that's when it completely ramped up. And I think I was having, I know now it was becoming chronic. And I think part of that was to do with over-medicating. So a lot of my migraines were actually rebound headaches, which were often worse than the migraine themselves. And I quite often have to go into hospital to be rehydrated, or for them just to stop the pain. It's absolutely unbearable. You know, they have the pain scale of 1 to 10, and I could never say it was 10. It always felt worse than 10, always felt, sort of 12, 15. The migraines themselves start off with the aura syndromes, which are quite similar to when I was a child. I still get Alice in Wonderland syndrome, but I get nausea. I feel euphoric or very down, and sometimes get aphasia, which is the inability to articulate or to find the right word, or sometimes completely garbled. Communicating is really hard. And then when the pain hits, usually over my right eye. It's centered in the right eye, and then it just spreads out, and it becomes like you've got it's the classic description of the hot poker, or I think of a screwdriver at the back of my eye. It's trying to push my eye out, and I'm often in bed. They're completely disabling. I'm in bed, vomiting, and with the pain for usually around 3 days if I can't treat it or I've not caught it soon enough. So that's kind of an explanation of a brief run through of my migraine.
As Deborah beautifully explained, there's a severity of the pain and the excruciating pain, but or the different symptoms that may go with it, and sometimes, like earlier in life, some symptoms without pain afterwards. And migraine is a genetic neurological disease. It's a disease that can have many more symptoms in addition to pain, and wide array of symptoms, including, as you mentioned, smells, but cognitive changes, mood changes, neck stiffness, nausea, vomiting, the Alice in Wonderland syndrome, the aura, which are transient neurologic symptoms that are reversible but can have many forms. It's not like, oh, you just have flashing lights and that's aura. People can have different forms of aura. Can you please talk about how long it took for you to receive a formal migraine diagnosis?
Well, I'm 60 now, and I got my first, what I think, accurate diagnosis around 10, 12 years ago, or something like that. So it's a long time. And I think the problem probably was that I self-diagnosed my migraines. I just walked into the doctor's surgery one day and said, I think I have migraines. My mum has migraines. And the GP said, yeah, you've got migraine, and didn't ask me anything else. So I think it took such a long time for me to get an accurate diagnosis. And that was really disheartening over the years. I did get various diagnoses, but none of them felt accurate, or I felt that I hadn't properly been listened to, and the questions that I felt were important weren't being asked. It was almost like I was being asked the questions and the healthcare professional was predicting what I was going to say, rather than somebody saying to me, tell me what this is like for you. Tell me what you experience. And the number of times I was asked if I experienced aura, and I'd say, what do you mean? And they'd say, do you have flashing lights? And no, I don't have flashing lights. That's not how I experienced my aura. But so in my medical ignorance then, I said, no, I don't have flashing lights. So therefore I thought, well, I can't have aura. But I do, as I explained earlier. So it took a long time to get the right diagnosis, which can be really, really, can add to the isolation of the migraine itself.
More than half of people with migraine are not diagnosed. And the lack of diagnosis, and then comes with it the under-treatment. Migraine is terribly under-treated. About 40% of people with migraine are eligible for preventive treatment, but only 17% are receiving it. And some studies have shown it's even worse in the workplace. And then there's the isolation, there's the stigma, the lack of understanding. But then you mentioned also the trying to keep up at work, right? You were self-medicating and then worried about rebound headaches. And there's this whole talk also about medication overuse headache. I don't like that term. I like the medication adaptation headache term that Dr. Young and colleagues came about. That term has changed over time, but it basically is a signal. If you have to self-medicate, you take over the counter more than 2 to 3 days per week, or keep dealing worried about rebound headache, it means that either something is missing, like there's something else contributing to the burden of migraine, or that migraine is undertreated. So also there's also some blame sometimes placed on patient, or you're taking too much. People are doing what they can to survive and stay working and stay functional, and that's the only thing available to them. You have to provide a preventive plan to reduce the frequency, severity, duration of the attacks. So that's also something I wanted to clear here, that we need to do better as healthcare professionals, so people don't have to self-medicate and be worried about the future impact of self-medication. So talking about the workplace, can you please tell us about your experience with migraine in the workplace?
I think when the migraine certainly became a big problem was when I was working as cabin crew or a flight attendant. I had that job for 24 years, and it was a job that I really enjoyed. It became a way of life. I loved the excitement of the immediacy of the job, and I love customer service. So it really fed into a lot of the things that I enjoy doing, as well as traveling, obviously. Unbeknownst to me, it was probably one of the worst jobs that someone living with migraine can probably have. So I, for a long time I was okay, because as I said, the migraines were perhaps episodic. As time went on, the migraines became worse. I was getting 1-2 migraines a week. So I found myself medicating to go to work. So I very rarely had an attack on the flight. If I did, I would take migraine medication, and the migraine medication worked, but very often a migraine outlives the medication. So I would find myself somewhere in the world for 2 days of my days off in bed, and then having to medicate to get home again. So it really impacted my life in a huge way. Latterly, it became impossible to keep that up, as well as hiding the fact that I had migraine. It just became an impossible situation. And looking back now, I think, well, yes, but the airline was a very big company and they would have sorted it out. But I didn't want to raise my head above the parapet and say, I have a migraine, anything else but a migraine, really. My first job, I had to leave. I took redundancy because I felt I couldn't talk about my migraines to anyone in the company. I felt the only way was to leave. And I left with very, very little redundancy compensation. But I retrained as a therapist. I became a counsellor, and I wanted to use my passion for writing and combine it with counselling. And I did that for around 7 years. But ultimately, the migraines just weren't compatible with having to have a job where you had to be there for your clients. And again, I was hiding the fact that I had migraines. And living with the condition and with that stress became intolerable. It just wasn't feasible to carry on like that. So I had to give up my practice, and I built up a very busy practice. I specialised in one particular area of counselling, and I was doing really well with it. So I unfortunately had to give that up as well, just handed my practice over to someone else, which was awful.
And there's so much stigma. Only 22% of employers think that migraine is a reason to miss work. And more than a third of people with migraine experience at least one type of stigma, often, very often. So that's a huge issue. And stigma itself, internalized stigma, is associated with reduced productivity. We know there are several work factors that can be positively associated with migraine-related productivity or negatively associated. And those that are positively associated are sense of autonomy, job satisfaction, support, especially from one's supervisor, and then physical adaptation to the environment, such as natural light, air quality, sound reduction, noise reduction, and then the negative work factors associated with reduced migraine-related productivity in the workplace, quantitative demand, like how much work you have to do, that oftentimes there's not much we can do about it, emotional demands, reducing unnecessary stress, social demands, how many people do you have to interact with on a day you have a migraine attack, that actually can make things worse. If you would like to talk a little bit more about the need you felt like you had to hide this, both in your first job and hiding your disease from your patients too?
So I knew that mentioning it, they would either redeploy me to work on the ground, or they would suggest that they would pension me off on medical grounds. And so I didn't want either of those scenarios. And I felt really trapped. With my clients, when in a counselling practice, I really felt that my clients needed to trust that I would be there for them. So the reason I hid my condition from my clients was because I felt I needed to look like the person who was dependable, that they could trust. And people coming to you with, sometimes very difficult issues in their life needed to know that you would be available for them. And I felt I was letting everybody down. It felt I felt absolutely useless sometimes, but the cost of that is that on my days off I would be ill. So I was sacrificing my personal and my family life in order to work and to do something purposeful. It's a dreadful kind of dilemma to have, really.
You are internalizing all that guilt and blame and pushing through, but then on the other side, some people think, oh, these people that just show up to work, so it means they're okay. But we have studies showing this. People with migraine won't work, and they show up at work, but they show up at work as a detriment of everything else in their life, like personal life, social life, family life. And then there is the other huge issue. Despite all your efforts, you unfortunately had to change career several times. And that's unfortunately not uncommon either. More than half of people with migraine have to change the career path because of migraine. What did it feel like for you when you had to leave your first job and then your second job?
I think leaving the first job, I felt in a way quite excited, even though I was so sorry to leave the job I'd been in for 24 years and a really kind of exciting lifestyle that it could have been. I felt that I had something to go to, and I was heading to university again to do my master's, and that felt really kind of uplifting and new and stimulating. So I felt really excited. I think the potential grief that I had in leaving a well-loved job was kind of cushioned by that excitement. When I handed my counselling practice over, I was completely bereft because I had nothing to go to. we need a purpose to get up in the morning and as human beings, and I had nothing to, I felt absolutely useless. There was nothing for me to do. I didn't know what career I could possibly have now with the migraines the way they were. And that brings a sense of desperation, huge amount of grief. We all have experienced grief in our life. I never expected to feel the amount of grief I did for my work. That was totally unexpected. And working as a counsellor, I felt I was doing something that was helping, and I was giving something to society. And now my migraines meant that I was withdrawing from society. I wasn't a functioning member of society. That's how it felt. So migraines were keeping me hidden and keeping me away from anything purposeful that I could do. That's a really difficult place to be in, and I did feel desperate.
Yeah, I'm really sorry to deal with that, and it shows an important point. The majority of people have a significant emotional impact of migraine, and it's extremely isolating disease, and it's kind of ironic. It's so common, it's very disabling, and yet it's so isolating because of the workplace impact, all the symptoms of the disease. So thank you for highlighting that very important point. What are some of the ways you manage to position now, thankfully, in the most supportive, understanding environment?
Over the years, I've learned that I had to be honest about my migraines and how severe they were. And it takes a bit of a mind shift to sort of say, I was going to say admit again or fess up that I couldn't manage to do something. By opening up and also by talking about the effect my migraine has had on me, on my life and my family, has really helped. Because a lot of people, I think, don't understand what migraine is like. So I think being able to explain that the effect it has on me and how it affects me and what the pain is like has really helped garner that support that I need. And I do have some really good support in my personal life, and it has really helped with my work that I do now as well, being upfront about the migraine, so telling people and being realistic about how that might affect my capacity to be there in my role.
Deborah, migraine has affected so many domains of your life, but can you also please tell us about the implication that it may have had for your loved ones, people around you?
Yeah, I think it's such an important thing to remember that, there are many of us who are lucky to have someone in their life who's there for them, and the effect on other family members, and especially maybe on a spouse, can be really almost traumatizing. And just being there for me when I have an attack is very tiring for somebody, and very stressful as well. Having to advocate for me to healthcare professionals, maybe phoning up in the middle of the night to find out what to do, is very stressful. And there have been lots of times where my husband's actually had to cancel his plans. He's sometimes phoned in to his work to say he can't come in because he feels he has to take care of me, and he feels really responsible for me and doesn't want to leave me when I have an attack. And also on, the wider family as well, having to cancel plans or not be there at important things. And I often got the feeling that people would be thinking, oh God, not again. She wasn't here for the last family gathering. Maybe it's something to do with family gatherings or, so it can be really tough on the people that you love most as well. That just adds to the guilt, the internalized guilt.
I think also from a healthcare professional standpoint, with COVID, like we could only allow one person in the visit, but I think even if it takes a few extra minutes involving whoever caretaker want to be there, we actually like them and want them to be part of the team whenever too many to try to address this disease. So I think it's important to welcome any caretaker.
I think that's a really important thing that you mentioned, having the caretaker or the spouse in the room as well, because a number of times I've actually had a migraine when I've had to go to consultation. A number of times I've actually gone in not really being able to communicate properly because of the migraine, and my husband thankfully was allowed into the consultation and was able to speak for me when I couldn't speak or give extra information, clarify things. So I think it's really important that they are considered as part of the healthcare package.
Migraine has such a significant impact on your career. Do you mind mentioning how this may have the financial repercussions for you?
I left my job as a flight attendant with very little redundancy pay. So I didn't really get much security from that. The salary was very low, the pension wasn't brilliant. Had I stayed on longer, I perhaps would have, built up more of a pension. So it really has affected my earning ability. It's affected my pension hugely. So something that is not my fault has affected my capacity to support myself into my old age. I'm very lucky that I have a husband who's able to support us both, but that also doesn't feel very fair to me. I want to feel that I'm contributing to my own household and my own family, and I've not been able to do that.
It's very common. More than a third of people with migraine missed on additional earning potential, promotions. So that's another way that migraine has a huge impact in the workplace. What do you think your healthcare providers could have done better to help you navigate migraine in the workplace?
Looking back, I want to say first of all that I have had some excellent care from healthcare professionals. But looking back, I think one of the things that was never asked was, how are you coping and are you able to work? And is this interfering with your work? It wasn't a question that was asked really. And I think more than anything that something I'm passionate about for people living with migraine is that we are allowed to be helped to stay in work. That's for me, the underpinning of everything. If you can allow people with living with migraine to stay in work, you're keeping a huge burden from the migraine, the person with migraine, and you're keeping a huge burden from society, because so many work days are lost through migraine. So I think what would be helpful is for me to have felt that the healthcare professional was on my side and was sort of helping me to find ways of talking to my employer perhaps, or signposting me to someone that might be able to help, an organization, or maybe even, you know, using their experience from patients that they've had or their training to say, well, look, this is how maybe you could frame it to your employer.
You mentioned that you had also good experiences for people who don't know how to start or where to start. Can you please share some about the positive healthcare experiences you had?
I think the very first healthcare professional that I felt really understood or wanted to understand, I think that is the key, isn't it? Is finding someone who wants to understand, was the GP I have now, actually. And she, one of the first times I saw her, she put her pen down and just kind of faced me, and she said, "So tell me what's going on." And I actually burst into tears because it was such a relief and release to have somebody who wanted to know how I was in a holistic way. And then I felt she was then on my team. She was on my side, so it felt a very positive experience. Even if she couldn't do anything to cure my migraines or to do anything differently, the burden seemed less because she had sought to understand my experience, and that feels really important.
What are some of the ways you found, like some ways to cope with migraine that you found on your own?
Well, when I got to my lowest ebb, when I wasn't able to work, and I felt that I needed something like a pain management course, and unfortunately migraine wasn't one of the conditions that you can actually get on a pain management course for in the UK anyway. And I thought, well, I need to come up with my own pain management course. So I thought I'll have 3 things that I'll do and see how it helps. And one of them was mindfulness, and the other one was cold water swimming, and the other one was that I changed my diet. I stopped eating sugar. So I tried those 3 things together, and whilst I don't think any of them cured my condition, they really helped me in the time that I wasn't working, that I felt I felt a big bit useless and not contributing to society. I felt that if I was, getting out of the sea on a cold February morning, my body was doing something really powerful. The mindfulness took a long time, to maybe several months, to actually get into it after I've tried it many times over the years. But it is like anything, it's like any skill, you have to practice, and it has actually changed my life. And it's made such a huge difference for me, but also I've managed to take it into developing a new career with it, which has been really, really positive.
Thank you so much for sharing. Do you have any final thoughts or anything that you would like to share that we have not discussed?
I think that's important to underline, really, for anyone who's an employer, and for anyone who's struggling to work as well. It's not your fault.
Migraine is a neurological disease. You either have it or you don't, and if you have it, unfortunately right now we have no cure. As you said, it's not your fault, it's a disease. Everyone with migraine is doing their best no matter what you do, you can still have migraine attacks. So thank you for really highlighting that migraine is no one's fault. And the other point, I think, raising education, raising awareness, trying to break down this stigma is extremely important. Migraine is so common and so disabling, it affects all of us, either directly or indirectly. And so much can be done. I think a lot of it starts with education and increased understanding and breaking down the stigma.
We hope you enjoyed watching this video and have gained a better understanding of migraine. Please be sure to check out videos on other topics in this series.